Okay, that's fancy.
Oh, that's nice.
That is nice.
I can see right now it doesn't have foot plates though.
No foot plates. I don't see
Any like
brakes or D-rings.
the armrests either need to be adjusted or there needs to be a better lateral support.
It was donated, like gives us something to start from.
Yeah.
This one,
I
was-
just don't think she's going to be comfortable putting him on a bus in a chair that doesn't fit well.
No, and that one can't even go on the bus because it doesn't have D-rings and all the other things.
Yeah.
so do
Or-
we- was donated too?
What?
This one was donated too, the one at home?
That one was donated just straight to mom.
Oh, okay.
So do we have one that he could use for the bus?
Not yet.
Well, the stroller one that I have has D-rings and stuff. Is that one not okay?
Megan, we
Yeah.
need to have someone come take a look at it if that's okay. Do you have some
Well,
time where we can do that?
Candace came by my office. I picked it up from the parent that donated it and brought it to my office. Candace came yesterday and looked at it and she said she felt like it would be okay for the classroom, but was not good for the bus because of him and his comfort opposed to, like, I think it meets all qualifications for the bus, I believe, but that it wouldn't be proper for him because of his scoliosis for the bus purpose, but for class, it would be fine.
I wonder if we will need to do, and I know this is something people don't like to hear, but I know with one of our other kids, we did some modifications until that student got their own chair. Because it could be a while before he gets his own chair. I don't know how long that takes through the clinic.
I'm not even sure if she has an appointment yet with Seating Clinic. Yeah. Teresa's
I don't
checking
even
her.
think she's aware of it. I think she thought that what she was getting was gonna be what she was needing.
Okay.
So that may be something we need to help her with.
Yes. Do
Okay.
you, Teresa, there's probably going to be lots of communication about all the things now. Do you want to pass him off to Miss Thelma at Summit Trail so she can communicate with mom?
I think that would be a good idea.
Okay.
Yep.
I'm throwing you in
We-
there.
We no, that's okay. We also, I want to say, I don't know how expensive those shares are, but we also can with partners at Summit Trail. And I was thinking maybe we can reach out to them to see if they have I don't know, maybe more resources, or they will be able to donate something, or to, I don't know, just to put that on the plate like an option maybe, in case that we cannot find a share for this kid.
Yeah, they should. If mom takes him to the seating clinic, they should fit a chair for him, but we don't know how long that'll take.
So here's where I need help from is it Vilma? Am I saying it
Mhm.
right? Okay. Mom, I think just needs some guidance on like to call Seating Clinic to get an appointment with them. I think that they have I'm assuming they have interpreters there once she has an appointment, but that's kind of going to be the biggest thing is she needs to get them called and then keep calling them to get an appointment, because typically it's several months out to get the appointment. And then at that clinic appointment, they will measure him and do all the things to figure out exactly what type of wheelchair he needs. And then that will eventually be the chair he can use on the bus. But it's a long process. So we kind of need to help her get going now with it so that she can get it going. So I don't know if that's
Okay.
something you'd be able to help with.
Oh, definitely I can do that. Is there any way you can send me all the information that she
Yes.
needs from that program and phone number?
Yes, I can make sure that you have that.
If yes, that will be great. And I can definitely, if they don't have someone who speaks English right away, I can actually make the phone like a 3-way call or something, so we can do that ASAP.
Awesome. Okay, I will email
Vilma.
you that.
Velma,
Yes, Jose.
Hey, can you add me on that, or Laura? Because
Yes.
Vilma is expecting a child. If it takes a long time, we don't know how much longer we're gonna have Vilma. So
Okay.
it's probably I need to help with that too for the wheelchair fitting and stuff,
Okay.
and make sure that the mom gets connected. So if you could CC me on it.
Congratulations,
Awesome.
Vilma. I didn't know
Mhm.
that.
Yeah.
Exciting.
Yeah, I'm in the process of it. Yeah, we're still working on that.
Okay.
Hey, just FYI, I talked to the nurse this morning, and I think she has some diabetic students that come to her during lunch. I don't know if we could jump to some of the medical stuff because she had concerns, mainly because of the suctioning procedure.
I just had my diabetic student in here, so we are good now.
Okay, all right, okay, making sure.
However, this is Sharon Morris, Director of Health Services, and I have, if you can just imagine at this point, I have a number of demands on my plate. So if it's possible, that would be great because that would allow me to move on. And I think I would like to participate in this. Otherwise, I'll have to jump out about the time you're getting to it.
Yeah, I agree. I would like Sharon's thoughts and input too. I think Sharon and I have gone back and forth, and I think are we still waiting for things from Children's Mercy? I have already put feelers out to the agencies we work with regarding possible personal nurse. I don't know how quickly that could happen or if they'll have anybody, but I've contacted 3 different agencies for them to start to see if we can get someone. Because I think we're kind of leaning toward he probably needs, but I'm not 100% positive.
Yeah,
Yeah.
until we really see him and get a little more information. The thing that concerns me is, the scoliosis, the severe deformities, the NG tube coupled with the aspiration risks with the dysphagia. All of that together seems like a bit of a perfect storm as far as really needing someone who's supervising him and can be assessing him along the way. Not just, if it was just a matter of keeping him from pulling out the feeding tube, that would be one thing. But it's way beyond that. If they move to a G tube ultimately, and I would hope that would be their plan. But if they did, then that might change the needs for that service. So we would want to reevaluate then. But with an NG, which cannot be delegated to anyone else, with the aspiration risks, the whole mobility, the underweight, all of that, I thought, that's going to take a lot of, that could end up taking a lot of nurse assessment on, needing to be there.
Okay. So I'll keep everybody posted. I've asked them to send me, typically they'll reach out, then they'll send me the information on the nurses. So Sharon, I might reach back out to you too when I get those to say, okay, maybe a good fit.
Yes, absolutely. And also as we get more information, more detailed information from Children's Mercy and specialists, that picture may change.
Yeah.
So.
Yeah.
And Sharon, do you want to jump in and add on the suctioning?
I was just going to ask, can you talk about the suctioning?
Yes, the suctioning is going, and the necessity, whether that is just periodic and predictable versus I'm assuming that that's due to potential aspiration and with the feeding tube and everything and his whole condition, it may be required. That is, with COVID, that requires an N95 fitting and a fit test. I have the resources for that. I had to put, that requires an entire respiratory protection program for the district. I put one in place for health services. I have a limited number of N95 masks, but that will be required to have that suctioning. And if those resources ever dry up, if we go back heavy into this and I end up no more N95s, then that could put at risk his being able to attend if we don't have the proper PPE to take care of him. But we don't need to worry about that at this point. But that is.
Sorry, if he has a personal nurse, do they supply the N95s or is that our responsibility?
It varied. I have asked the I have asked the agencies to provide their own PPE.
Okay.
And most of them will. One agency I said thought that they did not, that we would need to provide the N95, but I think others, they kind of went, of course. So,
Okay, perfect.
but you might, Heidi, when you're you may throw that into the conversation that they need to be fit tested for an N95 due to suctioning.
Okay, I'll email them back because I already sent the emails and all three are working on trying to find people, so.
Great.
I'm
And
sorry,
what
and I
is-
maybe have missed this, but does everybody in the classroom need to wear an N95 while he's
No.
being suctioned, or just the nurse?
No, we would take him out, probably take him out of the room to suction. So we would hope that there would be a place where we could take him and do the suctioning there away from everyone else. And so only then the nurse would need to wear an N95 because not everybody needs to be fit tested. We don't have, and limited supply, limited need, only in the presence of that aerosolizing, aerosol generating procedure. And so let's move the procedure, not N95 all the staff.
One concern that Annie had is she said she doesn't know where that would happen.
I have a room
Well,
off the side of I have a room attached to my room that they could go in.
I had heard that that you had that taken care of.
Yeah, so that's not a problem.
Yeah.
Megan, what other questions did you have?
Which Megan? Sorry.
Williams was what I was talking about, but anybody.
So I guess I'm just kind of wondering, I know that we'll have to do an evaluation for him, but now that middle school's moved to remote, like how is that going to look? Are we still going to bring him in for evaluation? Are we going to go to him for evaluation? I just kind of wanted to know what the timeline was for all of this.
I would say we'd want to bring him in, but that's my opinion, because I think we'd get a better idea in our setting than we would in the home setting.
Will he
Agreed.
be attending when the district is remote?
Yes, we would have him come to us.
So we're waiting on information from Children's Mercy about
Suctioning,
suctioning. Okay.
right? And
We
then-
have feeding information as far as the amounts. It's all through his NG tube, but we have the information on the amount of formula and water mixture. Mom has syringes. And so that part should be okay once we get going. It's the suctioning, I think, that is the biggest thing that's holding us up is how often, and I'll be real honest that Mom, when Teresa and I went, Mom just suctions him with a bulb, mostly through his mouth when she thinks he needs it. The suction machine was kind of an after, like, oh, wow, I'm kind of nervous about this. And I don't really want to use bulb on him at school. So when they called, they got orders for that. So now that's why that's going. But Mom has not used a suction machine with him at home at all, though.
Okay.
And we'll need physician orders for all of that, as well as directions. If he pulls out the NG tube, what are the orders for that? Because we don't, typically they confirm placement of an NG tube because of the risk of in the lungs. I mean, nurses in the hospitals, typically in the old days, we had our methods for doing it, but current practice is that they verify placement by X-ray before they give the first feeding. So we're going to need orders from a physician on what happens if that NG tube gets dislodged and comes out.
So Sharon, feeding, suctioning, and orders for if the tube comes out, those three things? Okay.
Yes.
And any
and then
medications if at school?
the formula, we'll need that more than just our notes on what the formula is. All of that has to come in physician orders, just as if they were in the hospital.
Perfect.
And we're still waiting for the machine, the suction machine. That is something that Children's Mercy is getting for the family, so.
And the tubing for that, all of the tubings that come with that. And it may just be that they use what they call a tonsil sucker. Any of that equipment needs to be provided. We don't stock that.
So Mom would have to, is that what you're saying, Sharon?
Yes, Mom would need to provide all the tubes, the disposable, the tubes from the machine to the, to the catheter, and then the suction catheter or tonsil sucker, whichever they use. And then also the NG feeding tubes, all of that is something that I mean, I assume he's coming with the feeding tube, but the formulas and all of that come from them as well.
And Children's Mercy had on the Children's Mercy documents that we got from when he was discharged, there was DME orders for the tubing and all of those things. I'm just mostly concerned that mom doesn't know how to navigate that, working with the DME and all of that kind of stuff. That's my biggest thing, that I feel like we're trying real hard to get him ready for school, but I'm kind of concerned that she doesn't know how to navigate that process with the hospital.
Does Children's Mercy have social workers and discharge? Because they
Yes.
should be doing all of that training. That's part of the package of discharging someone. You don't
I
just
feel-
launch them into the community.
Right. I think they do, but I know in talking to Teresa, when Teresa's talked to mom doesn't know about some of the things. Like she didn't know about, it had something on there about a car seat and she didn't know about that. And it had the, to contact seating clinic and she didn't really understand about that. And so I guess that's where I'm kind of concerned.
And how many times have we even communicated thoroughly to parents and then they walked away and didn't remember half of what we said? So
Absolutely.
we probably just need to keep following in and coming in behind and making sure there's understanding, but we could always send her back to them
Yeah.
versus the information coming from us, because
Yes.
then we can lose stuff in translation. So
Absolutely.
I think especially for some of that stuff related to his medical condition, they need to be the source of that information as much as
Absolutely.
possible.
I think if we could just tell her where to call and who to call,
Yes.
then that would be helpful.
Yeah.
Yes.
I'll pull all that paper or all those phone numbers back out of the Children's Mercy paperwork and send it to Jose and Velma so that they can tell mom that she needs to get them called back.
And you might send it to Annie too, so that she has contact information. Do we have HIPAA consents signed for release of info that we can talk to all these people? Because
Yeah.
that would be great. Because then if we see, if Annie or Megan, whoever's that, if Annie sees something that's concerning to her, she can call those people and find out where the gaps are and help with that. Because, sometimes parents at home don't do exactly what they've been told to do.
Mhm. Well, probably the biggest thing to get him to school right now is the chair and figuring out a chair and getting it to the point where we're comfortable bringing him to school in that chair.
So after talking to Candace yesterday, and hopefully I'm probably gonna butcher this, but she basically had said that she looked at the links that Megan and Olivia sent that were some ideas of transport chairs, knowing that he would need things added on. That when she looked at the add-ons and everything else, then we're talking a good chunk of change, and not sure if that was still something that as Olathe we were gonna approve to purchase or not. And I think as much as I wanted one of these donated things to work, it sounds like they might not. And so we would have to go back to the first plan A of seeing if we can get one through SPED that is approved by Olivia and transportation and all the fun people.
Would
Do
we
we
be able
wanna take a-
to, sorry,
No, go ahead.
would we be able to have a car seat in the bus and use that instead? And then we would use what we have here to go transport him to the classroom so that we don't have to worry about the add-ons until he gets a chair?
I don't think that there is a car seat without doing a custom order that's going to provide the support that this student needs. I mean, I don't think we can walk to Walmart and buy a car seat.
Yeah,
that's
but
gonna
even
work for
Children's Mercy Seating Clinic they might have
Oh.
something. I don't know.
Okay.
It's just a thought.
On his discharge papers, there was information about a car seat that is an adapted car seat. I can look back and see. I can't remember if that was a Call Seating Clinic, or I can't remember. When I looked up that car seat, it was about $900. Looked very smushy and well supported. I don't know if it's something that can go on the bus, but I could send you the link to that. And then I could also add that in for Velma and Jose to remind mom to call about that too.
Yeah, we can take a look at it for sure. I think it would also just go ahead and take a look at what was donated that Megan has. Even if it doesn't end up working for him, we would at least know whether it's rated for transport and just at least get the yes or the no from DS about that.
Okay.
I'd like to coordinate someone coming out to do that if possible. The transfer from, a stroller to the adapted car seat would also be a concern for bus staff to be able to do that. I feel like most often when we do a transfer like that, we ask parent to assist with that at the home, and then school staff to assist with that at the building. Is that a possibility? Is mom going to be, I assume mom will be home and able to help do that transfer from a stroller to an adapted car seat?
From my understanding, yes.
Okay.
And I think with the chair, Candace probably just needs to send us what she feels would be needed, all the add-ons and that kind of stuff, and then bring it back to us, right, Olivia?
Yes.
Will he not get a chair through Children's Mercy? I guess I'm confused as to why Olathe is purchasing his chair.
Well, it's gonna take a while.
That's not typical practice.
It's just gonna take a long time because he's hadn't been fitted for it yet. So we want to get him here as soon as we can. So we're trying to provide what we can so we can get here.
So
And-
we're looking at a $900 adaptive car seat to be a transition while we wait for the chair. Is that what I'm understanding?
No, I think we're looking at a chair. I mean, the car seat might be an option that, I don't know if it's one mom gets through the clinic, or Tom knows more. I was out when they had this discussion at coordinator meeting about purchasing a chair for transport.
Yeah, I mean, those are going to be like multiple thousands of dollars.
So the district has some transport chairs, right, Olivia? And
We have a couple, yes, that we do loan out when necessary. It just happens that our one chair that is transport approved and not just lift approved is currently being used by another student. So I don't have anything that would be appropriate for this student to loan out. But we have, SPED has in the past, in extenuating circumstances, purchased a transport stroller for students. It's just on a case-by-case basis. It's typically not our practice.
I guess my hope would be that when he's done with this, with all the things that can be taken on and off, if we had another student that needed a transport chair, we might be able to reutilize that chair for another student and just keep it in district.
Yes, I would assume that that would be our expectation, that we would inventory that chair like our other transport chairs and use as needed. This most often happens with early childhood students when with an initial class eval. They are expected to walk at some point, but are not ambulatory when we first are, we have that student to receive services. So they have it for a short period of time until the student becomes ambulatory. And that's most of what we use those strollers for.
And I don't know, when Tom, you guys had that discussion, I don't know that we knew the extent of Joshua's needs at that point. When Deb said, yeah, we would purchase a transport chair. So that, I don't know, that might change once we get all the information from Candace, finding out, exactly what he needs due to his needs. So
That's accurate. Yeah. We hadn't had Candace go out and I don't think that was prior to anybody going out and getting those measurements that I think Teresa and Laura went out there and grabbed for everybody. So we got sort of like an informal yes, but there was no real talk of a dollar amount or anything like that. So depending on what Candace comes back with in terms of, how much is this chair? Is it tens of thousands of dollars to do, or is it, $1,000? It really all depends on, what those recommendations are.
And I think from what I understand from Deb Chapel, the links that were sent to me that I sent to her, she was that was what was initially the approved part, and then the add-ons are gonna kind of double the price. So I think once we get the add-ons from Candace, we can resubmit it and see if that's something that they're still willing to do.
Right.
Does Candace actually need to go see him, or do you guys feel like she has enough info?
She reached out and gave us information that Teresa got when she went to see him this last time. And so all the questions that her and Melissa from SFT wanted asked, and all the measurements and pictures that Teresa got, I think gave her a good picture of what she needed, from what I understand in talking to her. She wasn't going to be able to go to his house.
Yeah, he's got some pretty significant needs in looking at the pictures that
Yeah.
Teresa was able to get while out there.
Thank you for doing that, by the way, Teresa.
Yes, Teresa, that was awesome.
Very helpful. We got to see his sweet face too.
Yeah. Seeing his mom hold him, that was very
Yeah.
endearing.
Mom did have a question. Are we aware of any daycare providers that she can send him to? She is really itching to get to work. I said I would ask, and I imagine, does she qualify for any CDDO type services? Is that something else that we need to help her with?
Yeah.
Okay.
I'll add that in all the documents when I
As
send
I
that.
said, we can get her on the list, but CDDO isn't going to be anything immediate.
Okay. I didn't know.
So there, Teresa, it's a like 10-year waiting list for an IDD waiver. However, he probably would qualify for the TA waiver and other things. So I think it would depend on what all the CDDO needs documentation wise, and then getting him going is a bit of a paperwork process.
Yeah, I don't know what paperwork he has to provide, like what, yeah, for qualifying.
Probably really all we are gonna have is the Children's Mercy information, right? Because Mom homeschooled him when they were in Honduras.
Yes.
And I don't know what medical records Mom might have from there.
And as far as birth certificate and things like that too, I don't know what all they would need to get him going with that. And then there's like a CanCare process to fill out all that information. And I'm sure obviously he would qualify if they have everything they need for that, but there's a boatload of information.
And Vilma's helped some families before with CDDO, so she can call and request a meeting. They didn't have an interpreter last I knew there, so she has scheduled them, and then they will call at that time, and she can have a 3-way call.
And I am gonna have to get
Yes,
off.
definitely. I can do that.
Breaking up, Velma.
No, that's okay. Definitely, I can do that. Like they say, I've been able to help, and there's sometimes if they don't have interpreters available at the place, I'm willing to go with them. I'm 100% there to help.
Thank you, Vilma.
Vilma, I will send you the contact information that I have for the nurse at Children's Mercy and for Mom, so that you have that information. I can send the contact information for the nurse out to everyone. She is the one that is case managing. So, you know, as far as following up on Mom getting training, or where are we with that?
Yes.
Respiration machine, all that kind of things. That would be that nurse. So I'll send everybody out that information. I am gonna hop off. Does anybody have any questions for me? I think Laura pretty much knows everything I know.
Yeah, Teresa, I was just going to ask if Mom mentioned if she needs anything or if he needs anything else other than, like, we had talked about some of those things when we were there, but is there anything else? I have a couple donations that people have.
Just basic needs.
Okay.
Yeah.
Okay.
So
And then Teresa, are you the main contact person with Mom? Or,
I am right now, and it sounds like we're gonna pass that on to Vilma.
okay,
Probably be pretty appropriate, and Vilma, is it okay if you text with mom? She's real comfortable with that.
Yeah, that will be fine. Yes.
Okay, so what I will do is I'll call mom, talk to her first, and then I'll send out a text that will include you.
Yes, yes, definitely. And I can introduce myself, and I can even make her like I don't know if Miss William wants to do that. We can make a phone call just to introduce ourselves and
Okay.
try
We
to
can
make
figure
her
out
more
a good
comfortable
idea.
with us. As
Okay.
And just to
Yeah.
clarify again, Jose will be a part of that as well, because there is a strong chance that Vilma won't be with us for very much longer, correct?
Okay.
So, okay.
Thanks, Carrie.
Yeah,
Mhm.
I did want to ask, so going forward, is the plan to meet with mom and the two teams again Tuesday? I think that was thrown out there. Or is it just for Teresa to contact mom and say, hey, Summit Trail staff's going to be contacting you to kind of go forward? What's the plan?
I'm comfortable with whatever the Summit Trail team wants to do. If they want to have, a with Teresa there, or if we just want to do Summit Trail because we've got the information from Teresa.
I'm willing to do whatever.
I say take that off
Megan,
your
I
plate.
think I'll kind of leave it to you because you are the case manager. I feel like you're gonna have to kind of have the I think we need to do whatever's gonna fit more for you, since the Santa Fe or some of these folks know more about them. So I kind of would rather follow your lead.
yeah, I think I would just kind of like some of the key players to be involved, talking with mom next week, just so that, we don't miss anything in translation and things like that, so we can get lots of clarification and stuff like that, if that's all right.
Perfect. I can do that.
Okay.
Okay. I will send out that email later on this afternoon.
Okay, thanks, Teresa.
Thank you.
Thank you.
And then can I just real quick, I just want to summarize a couple key things just to make sure I'm on track. So right now we are waiting to find out about the wheelchair as far as the add-ons is concerned, so that he can have transportation. So that's one thing that's on the list of things that need to be done. The other one is Heidi is working on nursing, and we are waiting on the suction stuff. So once we have nursing and suction, those orders and things like that, then that is another component where he will be able to attend school. So those are the two main things that we're kind of holding on. Is that correct?
Yeah.
Okay. All right. Anything else? And then, we've got like the other paperwork and CDDO and things like those are important, but the two main things to get him here so that we can conduct our evaluation is those things.
Yes.
We,
And Megan, I sent a box and I think a package of diapers to you yesterday. Okay. And then I have some clothes and a winter coat for him that I'll probably swing by his house and just set on the front porch with a little note. I might save a couple of the clothes back just so that you have them at school. And then I have 2 donations that people have given us, that as you see things for school that he needs, if there's more clothes or things like that, or in talking to mom, between Jose and Vilma and you, if you guys find more needs, let me know. And then I think we're also on the other end, Heather Schoonover is helping with getting stuff for the family as needed.
Okay.
I don't know all the details about that part yet.
Is it just him or does he have siblings?
Just him.
Okay.
And mom. Him and mom.
They're living with Aunt, correct, right now, Laura?
What'd you say?
Are they living with Aunt right now?
Originally I was told friend. I'm not sure if it's an aunt or a friend. Another person, yes. Yeah.
All right.
Does anyone else from the Summit team have questions or need clarification for anything before we meet again? Go ahead, Bree.
Okay, mine is like way down on the totem pole. But I've read in some of the emails that have gone back and forth that he has a lot of tone issues and things like that. I would want to know, as far as like doing any range of motion or certain positionings that we are or aren't allowed to put him in. Are we allowed to stretch him? Are we not allowed to stretch him? Kind of some of those basic things. Because sometimes with kids with a lot of tone, they don't want you to try to perform range of motion because you might tear things. So that would be one of my questions that we would need to find out from Children's Mercy as well.
As far as the medical, we were talking about, and Megan pointed it out, the sectioning, the N95 and all that stuff. You know, I think I would worry about finding any people so quickly. I don't know how fast that turnaround can be. It sounds like we identified the room that would happen. But Megan, I think you mentioned that too, right? That the sectioning is another kind of like, hey, we got to get through this hurdle first.
Which Megan? Megan, Nurse Megan?
You, Williams.
Well, I mean,
Because I know the nurse had big concerns about that, you know, rightfully so with COVID and stuff. She's like, you know, there's this whole thing of like the N95 has to be, the person has to be fitted and all that stuff has got to be in a whole separate area. So I want to make sure we have that targeted.
yeah, so we have identified a place where that will happen. And then Sharon talked about the fitting and having the suction machine and everything that we need for that to happen. So as soon as we have a personal nurse for him to do that, I think that's what the plan is.
Realistically, how soon are we thinking like he could actually be coming to a summit? Like, are we thinking the 30th or even like the first week of December? Like, what do you see, Megan Williams and Schaefer?
I don't know. It depends on when we get all of those transportation and nursing components in place. So we're kind of waiting on that.
Yeah, I don't think it's going to be like very quickly, just because everything's got to fall into place and we need everything to line up.
Yeah. And I told the nursing agencies I'd like, you know, I said my guess or my approximate date of him starting is the first part of December. But, you know, I don't know how many nurses they have that they could even start sending me information on. So.
And will that nurse ride the bus with him?
Yes.
I want to be able to give the parent some sort of picture of like, hey, with all these things in place, you know, the potentially start date would be, you know, this, you know, December 7th or something like that. And if that's going to be too long, you know, is there a point where like we need to go to the home, you know, or something can be worked out, or do we Zoom with them or something? I don't know. You know, that might be something to also be thinking about.
To start the eval piece, Jose.
Yes.
Yeah.
You know, so we can, you know, because he's our kid, you know, he lives in our attendance. We have to obviously, so we can't just bring him into the building, but he is also, you know, in our district.
We had
Right.
talked about remote and offering that as an option. I think we just have to make sure that the team understands all the barriers with that. Megan would need someone there to interpret, and we would need to get them a device, make sure everybody knows how to use the device at home that's going to be with them, and all of that too. So, I mean, I think that's totally an option until we can get him here. We just need to make sure that mom would, I guess that's another conversation to have with mom.
Mm-hmm. Materials, that kind of stuff, you know, for doing the whatever Megan would have him doing, and OT and all that, speech.
Where does he live?
In Santa Barbara Mobile Home Park off Ridgeview. For Monterey. That's the address.
Mm-hmm. Yeah, because I think in order to do remote learning, you know, which again, I mean, I don't think we really have a whole lot of choice. We might have to offer that if we can't get them in sooner but there's obviously we have to make sure we have a device. We have to teach the person how to do it. We have to get her accessibility through Wi-Fi and have an interpreter on our end, because mom's going to be a Spanish speaker. She'd always be the one on her end working with this student.
Right.
So yeah, there's definitely a lot of things to check off.
Mhm.
And we still don't have the PWN to evaluate signed, everybody,
Oh, yeah. Okay.
Typically we say 15 school days is the reasonable amount of time in order for a team to sort of start an evaluation if a parent requested one or we encountered one. I'd say 15 school days is probably up next Monday. Anjanette gave some guidance about, hey, let's try and hold off as long as we can so that we're not burning days for a team. But I'd say a team would probably have to take into consideration if, when to start that evaluation and what you can do as a part of once that evaluation is started. I imagine, you can look over that consent and then have it signed next week, and then do any remote assessment as possible, kind of like what you described. And if you can get a device over there and there's somebody available, maybe there's an hour or two evaluation period that, I don't know, the OT can do something, or the speech path can interview someone, but doing as much of that and getting all your records together and getting all that done, and not really starting on any kind of in-person assessment until we've got the health and the chair data or the chair information. But when you want to start
And I think
go ahead.
Yeah, I think it can be done. I definitely think that that's a possibility with the kids going remote. I guess that kind of frees up some of my time, not everything, but if we also have to reach out to the parent and find out, are they comfortable with someone coming into their home and all of that kind of thing, just to even interview them. Like, so if Kate, the speech therapist, has to interview or kind of have the student do something or ask questions from the parent, it is a form of starting that evaluation anyway. I can definitely kind of try to work around that, or if OT is going to do something, or PT, or even Megan Williams, all those kinds of things. It's not ideal, but unfortunately, like you said, Tom, and that's why I'm like, I think we might have to do some of this stuff remote. We have to jump on it because we're obviously bound by that. But I will have time to be able to help out. So if that, I need to be the one going to the house, or definitely that's something we can introduce the parent. That way she knows, like, hey, they're moving on it. They're not just we're stuck. We can't do anything.
If we do it like a Zoom eval with the team, could we maybe, in the efforts of less time in someone else's house or saving Jose's time and kind of all of us, like, just take a block of an hour or 2 hours where we're all full, like PT, OT, speech, and Megan are all, and nursing are all together, and just do,
An arena. Yeah.
an arena.
Style.
Yeah. I mean, just ask, Jose can interpret and ask what we need to ask, or maybe have her test what we need to test, and kind of enough, just the bare bones.
I think that makes a lot of sense. I think especially with the accessibility with Zoom and stuff, I think that can definitely be worked in, and that's always like, hey, who's available when and stuff. But I think that, again, also that way we're not intervening into the mom's home as often as we can. I think trying to accommodate her time as well. But I think that's a great idea.
Does the family have something to Zoom on, or has the communication been in person or just by phone?
So far, everything's been over text or phone call or in person.
So that might be something if she doesn't have a way to Zoom.
We'd have to get him a device probably out there.
Yeah.
To start doing some of what we're going to do.
And see if they have internet.
And part of that is, showing up, showing the parent how to do that and all that stuff. And I think all of that stuff would have to be done. If it needs to be through my phone, then so be it, not a big deal. I don't know if I'm assuming the student is registered at this point since we have paperwork for him.
Tom, did he enroll?
Yes, he's enrolled. He's been pulled over to SE, and we've started
Okay.
that consent for everybody.
Yeah, so maybe that can trigger us getting him carry a device, for the family. We can maybe start with our librarian, kind of getting one set up, or we can get one for him so it can be assigned, and then that way in the next several days, we can take one there and get it set up and stuff as much as we can so that it's easily accessible for the parent. And like I said, if I go to the home, can help her with the Wi-Fi and all of that stuff, make sure it's connected, and we'll find out if they have Wi-Fi. So all of those things will be very useful. I mean, just getting the student access, I think, will be one thing to do, so definitely I can help out with that too.
And Jose, we can request the hotspot for the house if we need to on their behalf, and then take the form and have them sign it. So if we find out that they don't have internet, we can do that.
And Jose, I'm
Okay,
happy to
so-
help too. So if you need me to go out there too, and
Yeah, I think that's good, because I also think that it needs to be like more than one person showing up. I think just to represent the district, I think that's very helpful, and I think safety is always a big thing. So I appreciate you offering to do that. I think that I'll definitely take you up on it.
absolutely.
All right, you're gonna buy though the first time that we go out there.
Okay.
And just so everybody knows too, mom is super, super sweet. You guys are gonna love her. She talk about being intrusive. I asked her if she could feed him in front of me so I could watch. And she was so appreciative of it and understanding, and said that she's glad that we got to see so that we'll know how. And I think she's gonna be so great to work with, and you guys are gonna love her. And he is just a doll. I'm gonna have to just come over to Summit Trail and see him all the time. All right. Well, let me know if you guys need anything else, and I will kind of, as much as I want to stay keeping on working with him and the family and stuff like that, I'll be passing it over to Teresa for Summit Trail. But holler if you have questions. I will today though send the email to Jose and Vilma, and I'll add people on it that need to be, so that they know what to talk to mom about with seating clinic and which orders we still need and all of that fun stuff. So I'll send that out.
Yeah, I think at the nurse, the one that's helping now, and then Annie is
Yes.
the one that's the permanent one. She's out right now though.
Okay.
Is the
Sounds good.
nurse that's involved, Laura, kind of like a navigator that is going to help mom get appointments and things set up, kind of helping to organize?
I think so.
Okay. That's good to know.
And I have not talked to that person. That was only through Teresa. So we just recently got that information when we were asking about suctioning. So. Okay.
Megan, do you have any other questions?
I don't, but please, I don't care about the emails, so please keep me in all emails and in the loop, just so that I can stay on top of it.
Absolutely.
And I would like to go do a home visit as well. I'm sure Kate does too. So I think that if mom's okay with that, we would like to do that. So, all right. Thank you everyone for your input and information, and we're excited.
Yeah. As I hear about personal nurses from the agencies, I'll let y'all know. So,
Okay.
Hey, Megan Williams, will you talk to Megan Scott about someone coming out to see that chair just in case?
Done.
Yeah.
Or Olivia, not Olivia, not Megan
Already
Scott,
done.
Olivia.
Yeah,
Yeah.
we're on it.
And then I'm pretty sure, I'm trying to think back, because the student that donated it, we had looked at it for her for transportation possibly. And I'm almost 100% sure it's okay with what Children's Mercy said, but I don't know about DS. So you'll just have to check on that. Sorry.
Yes, no, they will do their level of testing. Their standards are pretty high,
That's what I was thinking.
appropriately so. And so we'll allow them to do their eval and give us their recommendations. So
Perfect. All
So
right.
if
Thank
they
you.
approve this chair, then he's good to come to and from. Like, we're good with this chair, right? For now.
I think Candace might want to give some
Yeah.
thought on that. I think she had some concerns with if we need to do something to make it more comfortable for him.
Okay.
Yeah, she had kind of made it sound like she thought because of the scoliosis, this one would, or I'm saying this one like it's still in my office, that one wouldn't work because of the scoliosis piece. So we didn't talk for very long about it. She might have even talked to Bree a little bit more about it, so I'm not sure. But she kind of made it sound like it was a no.
So is this the one that we're gonna add add-ons to?
No, we would purchase one, a new one, and then add add-ons to the new one. Like when we purchase the new one, also purchase add-ons to assemble a new one altogether
Okay.
for him.
Well, then why are we looking at this one if we're not gonna use it?
Well, this one was donated yesterday and I got super excited and probably way ahead of myself that maybe we could make this one work instead of getting a new one. And so I had Candace look at it, but
We
she's
may
not sure.
have to do that in the interim if we can.
Yeah.
Okay.
But I think also with it being donated, we may keep it in our stash so that if we have another kid that comes that doesn't have a chair, that we would have a chair already, right, Olivia?
I think so. I mean, the first place to start is just make sure it's transport approved. That way we know whether or not Candace should move forward with looking at adaptations or not.
Yeah.
For either way.
Megan, she did say it would be okay for him in the classroom though. So,
Oh, yeah. Okay.
okay. All righty.
All right, guys. Thank you.
Thanks, everybody.
Good to see your faces.
Yes.
Thank you. Bye.